Dr. Chris Winfrey, welcome back to the Tick Bootcamp podcast.
Thank you so much for having me back.
We are excited to have you back, and I will have to share with you that I was very excited all day about rejoining an interview with you. I had met with you at the ILADS conference. We had only 15 minutes together. We did work through some of your background at that conference, but we just started to touch on some really important, at least in my view, some really important topics, and our time ran out. So first, I'd like to just invite folks to listen to episode 488 of the Tick Bootcamp podcast, so they can learn more about Dr. Winfrey's background. And now we're gonna jump in. So, Dr. Winfrey, just very quickly, can you just share with folks where you practice and what type of a practitioner you are?
So I am a board certified psychiatrist. I practice in Marlton, New Jersey, and I have additional trainings in environmental work, nutritional psychiatry, psychoanalytic, psychotherapy. I've been trained through ILAS, and I'm in peer groups for mold toxicity, and some other sort of treatment interventions and modalities. And my practice and work has started to shift away from thinking about mental health as kind of like the duality between mind and body, and started focusing more on kind of brain health in general, and environmental health, and then kind of coming back to the concept of mental health. And so I practice neuropsychiatry here at my private practice, New Image Wellness in Marlton, New Jersey.
All right. So what excites me, I know our folks will understand this after listening to me, and some of the things I've been developing lately is I'm excited because you're a brain doctor, right? And I'm certainly all about the brain. Thankfully, Matt is finally coming along and becoming more and more about the brain. I wouldn't say Matt's all about the brain yet, but we'll get him there, Dr. Winfrey. We'll get him there. So what I thought we would do today is sort of have a round robin between me, you, and Matt. And I'd like to sort of put out some concepts that we've been developing, or I've been developing, and get your reaction to these concepts. So the first concept that I'd like to put out there is that I believe well, actually, let me say, I believe the most important organ that someone should focus on, if they are going to be focusing on an organ when healing from Lyme disease or trying to overcome chronic Lyme disease, is the brain. What would your reaction be to that?
You know, that's a tough one, because the Lyme disease, or that involves multiple different species of Borrelia bacteria, this spirochete, is a bacteria that's very unique compared to some other bacterium, where it can traverse through cell walls, cell membranes of the body and different organs, and infiltrate just about any organ in the body. And that's kind of important to kind of understand, because most other infections, urinary tract infection, pneumonia, upper respiratory infection, we oftentimes think about infections being localized unless a barrier is breached and it gets into the bloodstream and it circulates elsewhere. That doesn't have to happen with Lyme. Because of that, it can go into multiple organs, and it oftentimes affects multiple organs. Then it becomes a question of, well, how do you treat a person that multiple organs have been impacted oftentimes? And where do you start, or how do you go about it beyond just antibiotics? To your question more specifically, the brain is the most important area. You know, I can see why you would lean toward that, but I would think it would kind of put one into a sort of fragmentation, or into a sort of duality, or a sort of scatteredness in terms of how we think about the body. So I would say that it would be very difficult for one to function if the nervous system is not functioning well. But I think I want to take a step back and say the brain is the central nervous system. It's part of the central nervous system. The word central is operative, meaning that there's another nervous system outside of the central nervous system. And then the second category is peripheral nervous system. And under the category of peripheral nervous system, you have other types of nervous system. You have the enteric nervous system in the gut. You have the autonomic nervous system, the circulatory system as a nervous system, etc. What I would say specifically about the brain is that the brain is the central organizer of the nervous systems. And I would say all of the nervous systems matter because they talk together into a bidirectional sort of pathway back and forth with the brain and things. And so I would say that if you have your enteric nervous system all jacked up in the gut, for example, I would say that that would have an impact on the brain in a very secondary way. And so in that regard, I would not primitize, I would not make the brain primary in that format, but I would make the nervous system really central to the conversation of treatment and focus next to or akin to the immune system.
Okay, so let me challenge you on that. I listened to a podcast that Dr. Andrew Huberman had posted in the last couple of months, and he argued that every single thing that happens to you in life, from the day that you're born until the day that you die, is controlled by the brain. Would you agree or disagree with Dr. Huberman's argument? And if you agree with his argument, would you think a little bit differently about your last answer?
I don't know that I would say control. I would say regulated. I think regulate has a better sort of meaning here that offers a opportunity to look at relationships throughout the body, as opposed to the brain being like the central, the most important domain. That what happens in other areas of the body are important to what is happening in the brain. So let's take a hormone, for example. Hormones oscillate at a certain rhythm. And one of the major areas that hormones work is the brain. And so if another organ is out of balance or out of rhythm, then it's going to affect how the brain is utilizing that information and processing it through. And so I think that I understand the concept and the sort of primacy of thinking of it that way, but I think we run the risk of thinking about trying to impact the brain and improving the brain function at the expense of not the other sort of signals and inputs that it needs from elsewhere in the body. And by that, from that perspective, it doesn't get the coding and the other information that it needs. Even if you're repairing, for example, cellular damage and things like that in the brain, it needs those other signals and rhythms and connections for it to do what it does.
Okay, so why don't we first talk about expressions of the brain, right? And one of the things that I've been thinking about recently was a metaphor that Steve Jobs had used when he was creating the iPad. And what he said he wanted the iPad to be was a piece of glass that would present differently based on whatever app had been loaded onto the piece of glass. So if you needed a calculator, you'd have a calculator app, and now it's a calculator. If you needed a phone, that piece of glass would then become a phone. If you needed access to the internet, it would become the interface for the internet, and this piece of glass would just change in function. And in thinking about that, I think the human body is largely just a piece of glass, and based on our brain's expression, our body is going to change based on the brain's expression. So, for example, the physiological expression of our brain versus the psychological expression of our brain versus the spiritual expression of our brain are all going to be different, and we are going to present differently based on whether it's a physiological presentation, an emotional presentation, or a spiritual presentation. And I'm going to go into some detail on that, but give me your reaction to my metaphor.
I knew we was going to have some rich conversations today, but I didn't know we was going to get this deep. And I don't even think we've gotten into much of the interview yet. You're going deep really, really quick.
Dr. Winfrey, I just want to tell you, I chatted privately, and I want everybody to hear this, that right away, it's the first time I'm meeting you. I love how comfortable you feel politely debating with him because you're kind of slapping him around and I'm loving it. I'm sitting here like, yeah, keep beating him up. Keep telling Rich he's wrong. So we love learning, and I've already learned so much from you. So keep it going. Keep slapping him around, please.
So your question is around manifestation,
Yes.
how we present in the given moment, and that there is some sort of mutability of our body, and it's at some sort of default representation. And based on the interaction with a person or an environment, we're going to morph and express what we need to in that moment to connect with that moment.
Correct.
Yeah, I think that makes sense to me, that what we call forth in any given moment is going to take in, our body is very sophisticated and is going to take in information, it's going to surveil the environment, the people, and is going to send that information to the body some sort of way. And then that is going to change its expression and its output. I think that makes sense to me.
All right, so let's first talk about the physiological presentation of the brain, where the brain is first going to be sensing objects in the environment. And that sensory data is then going to result in a perception or an image in the dark brain that we have, which will then trigger our thoughts, our feelings, and our actions. Now, of course, all of that data that we're taking in is going to be filtered based on the beliefs that we have. And in many cases, what we perceive, what we sense and what we perceive is going to be driven by the neural pathways that have been uploaded into our brain during the course of our life. Would you agree with my analysis of the physiological presentation of the brain? And if not, I certainly wouldn't call it you slapping me around. I'm happy to learn. I just want to be right, not necessarily. I mean, I want to learn rather than be right. Matt, on the other side of the coin, as you can tell, he wants to be right. So,
Rich, nobody can see me. I'm sitting here doing a slapping, movement with my hand instead of the listening, just so they know.
If one of our guests educates Matt, he feels slapped around. I feel blessed by learning from the smart people that we have on our podcast.
So your question is that information is going to come in and it's going to go through a filtering process. And one such filter are our belief systems. And as it goes through that filtering process, we're then going to think or express something based on that. Is that what your question?
No. My question is do you think that the primary physiological function of our brain is to sense and perceive objects in the environment?
I think that I wouldn't say our brain only. I would say our nervous system, which I think is more germane to your question than the brain. I want to keep emphasizing the immune system has a nervous system as well. I don't think every memory is encoded in the brain. A lot of memories are encoded in the immune system. It has a memory, and we primarily think about that in terms of antibodies and things of that nature when our immune system is reacting to certain things.
Okay. Can I just interrupt for 1 second? Are there neurons in our gut? I mean, do we have brain cells in our gut?
We have neurons in our gut, yes.
Yeah. Okay.
Yes. And those neurons, we have neurons that run through our entire body from head to toe. And the largest collection of them is in the brain, and infinite number of neurons and connections and synapses, just so many, but they are running throughout the rest of our body in very intricate ways as well. And so all of this information is shooting up and down all day long. And one of the reasons I want to highlight that, let's just take the gut, for example. We've used words kind of colloquially. We'll say, I had a gut feeling about something. Or my gut told me not to do X. Or when we're saying that, we're saying something about our gut is picking up something. And we say it very casually sometimes, but I'm in this moment impressing upon people that your gut is picking up information that's not quite clear to your brain. And the work there is to move from an intuitive sort of perception of picking up something that's kind of outside of your cognitive domain, and to move that to consciousness, to understand that. And so I would say then, if we incorporate that, we incorporate your immune system is picking up information that is bypassing your conscious awareness all the time. And it's operating in ways that we're not even thinking. That's picking up information. And so all this information is being collected into some sort of experience and being organized, and we're trying to make sense of it. We cannot make sense of all of this information. Most information we encounter is unconscious. Very little of this information becomes conscious to us. And so when we're thinking about it that way, we're trying to, in some ways, navigate life with all of this information and all this experience that we have, and we're trying to make sense of it the best we can, but we can't get close to the depths of how much information there is. And so I would say that as we're taking in this information and we're encoding it, information comes in, information goes out. And the filtering process of our immune system is to make sense of that as much as possible, to kind of give us a sense of where we are in time, where we are in space, how our body is moving, and how we're interfacing with the things we contact physically, emotionally, and then even beyond in a very spiritual way.
Okay, so I appreciate you clarifying for our audience that I'm discussing the brain when I should be using the term central nervous system, right? So it's the brain, it's the nerves, it's the connection of the nerves to the body, the signals that are going from the brain to the body and from the body to the brain. Would that be a more accurate description of the system that we should be talking about, rather than my very weak description or characterization of the brain?
Yeah, I like the word nervous system in this sort of discussion versus just the brain. Yeah.
Okay. Now, one of the things that I love that you've already started to talk about is now the way that we are processing data that's coming into our system, right?
Yeah.
And in some cases, we are processing that data in our gut, or we're getting feedback that we feel in our gut rather than some other portion of our body. And I think that's particularly important in this conversation regarding Lyme disease, because one of the things that Matt and I talk about all the time is the onboard diagnostic system, where the best tool I think a doctor has and a patient has, if the doctor and patient do have a healthy partnership, is the patient's onboard diagnostic system, where there is a healthy interaction between the patient and the doctor. And the doctor is not just looking at clinical data, and the doctor is not just looking at the diagnostic testing tools, which we know in the Lyme community are relatively weak, but you're also using the patient's onboard diagnostic system, or their gut. So can you talk to us more about how patients can use that as a tool for determining whether or not, for example, a diagnostic conclusion is right or wrong, and whether or not a treatment protocol is right or wrong, and how to communicate that to their practitioner?
Yeah, I think that's a really, really good question. And I think it's really important. And this is challenging because much of the Western medical system is all about not operating in the intuitive. And so the Western medical system in some ways sought to separate itself from such a way of communicating and way of interpreting, and wanted to have a more rigorous, defined sort of process to thinking and experiencing and interpreting. And then when things fall outside of that sort of structure, it makes many Western doctors and such very uncomfortable. And I think that our Eastern system is much more comfortable working in the intuitive. And in some cases, how do we then merge the two together? Well, we get the Eastern intuitiveness with the sort of diagnostic confirmations and clinical utilities of the Western system. How do we merge those two together? And in some ways, that's what I hear in your question here. And so first and foremost, I think working with a person, a doctor, that's going to be open to that. I think we're communicating a lot when we share nowadays, but it is very hard to receive and to listen. And one particular reason in this instance, it'd be difficult to listen, is that there has to be some sort of framework for what is coming in that I can do something with it. And if you're communicating with a person that doesn't already have a certain framework in their repertoire of thinking, then as the old saying goes, you're going to be casting your pearl before swine. And so I would strongly advise not to do that. It's going to be a headache. It's going to be very frustrating. It's going to be very difficult, and you're probably not going to get anywhere. And so that would be my first suggestion, is working with somebody that can be comfortable with that sort of style of approach and thinking about it, incorporating it, and giving space to that and being able to foster that sort of relationship. The second sort of thing I would recommend and suggest based on my experience with patients is to be able to name it as such and then give room for it to being wrong. I think sometimes when people operate in the intuitiveness, they operate with a certainty to the intuitiveness. And one of the difficulties is, and there may be legitimacy to it, but they're expecting kind of another to kind of be deferential to that sort of process that they only know themselves, and it's kind of cut off to everybody else. And I think that given space that they could be wrong enables another person to come into that space with them. And then secondly, also that the timing, their circumstances, and even their emotions also could be blunting or affecting their interpretation of that experience as well. So I think giving space to that would be important.
So we would define that as a data point that the partnership between the patient and the practitioner will use and analyze, but it's not necessarily determinative of what steps or processes or diagnoses you should be taking. It's just a data point.
Very much, very much.
Okay. So now let's talk about some of the challenges that come along with the intuitive data point and the interpretation of that of the intuitive data point. One of which is gaslighting. In many cases, folks are traumatized by the diagnostic failures of their contact with practitioners. In fact, some of the research that Dr. Brian Fallon has done, I think, definitively proved that at least with children, it takes approximately 7 practitioners to properly, before a proper diagnosis of Lyme disease is located. And in many cases, the first 6 or 7 contacts with doctors is going to result in gaslighting, where a patient is going to be either told or it's going to be implied to the patient that it's all in their head, that there's really nothing wrong with them. Now, of course, that's now going to create doubt in your capacity to trust your intuitive responses. It's going to interfere with your capacity to interpret that. So I guess my question is, do you believe that is the case? And if you do believe that's the case, how do you, as an enlightened practitioner, discuss with the patient the importance of providing you with that data point, but understanding that perhaps because of the experiences that they've had leading up to coming to your office, that perhaps the emotional challenges that they have to deal with may pervert the interpretation of the data that's coming from their gut.
Yeah, I think this is a really important topic, and certainly a lot can be said about it. I would say that, what I think is really key here is to, at the very basic level, I feel off. If you're feeling that way and your gut is telling you that part, right? Trust that. When we get into what is off and how to think of it and how to treat it, it gets a little messy there. But at the very basic level, if a practitioner is saying your blood work is fine, you're fine, I would not trust that. If I feel off, I am off. Now, how we go about thinking about it, putting a name to it, and devising a plan, that's a different conversation. I oftentimes will tell people, well, I've been to this doctor and this doctor, and they say I'm fine. They ran all these tests and I'm fine. So, well, first of all, there's easily 1 million tests that can be ran on the human body. Easily. No understatement, easily 1 million tests can be ran. I highly doubt any one doctor has ran 1 million tests. And until such, because a few of them are normal, means absolutely nothing if you feel off. And then it becomes a conversation of which tests were ran and at what time were they ran and how are we going to think about them. And that is more of an analytical process. And so I think sometimes that can be discouraging to people in that regard. No one is running 1 million tests, okay? So that means that there are hundreds of tests that still have not yet been ran that can provide us information about what's going on.
Dr. Winfrey, isn't there another problem with tests, and that is that the analysis that a test is going to use to determine whether or not you are in fact sick or not sick, for example, is going to be based on a bell-shaped curve. And if you're an outlier, you may not even with a test that is accurate in the moment that you're being tested, you may be an outlier. You may not fall within that bell-shaped curve, and as a result of not falling in that curve, you may not get the results that the average population would get from that test, even under the best of circumstances, even if it was 1 million tests.
Yeah, I think that's true. I think that the test that's used, the test has a certain sensitivity to picking up things and a certain specificity to be able to differentiate from other things. And sometimes hospitals and certain systems have not recalibrated their instruments in a long time. And certainly that could be an issue in terms of the calibration of the instrument, the quality of the instrument, when the instrument was done, how the instrument was calibrated based, as you said, on the population of people that was testing it. It came to some sort of calibration number based on those people. And yes, so where you get a test, if you are from Europe and you come to America and you get a test done, or if you go somewhere else where your particular demographic and profile was not studied, then yes, you could be out of calibration for that particular machine. And that's something to keep in mind and consider that, yes, sometimes tests do not provide the most accurate information.
Right. And in many cases, the population of people that were utilized to set up the calibration are not you. Most tests were calibrated on men, and most tests were calibrated on white men. And as a result of that, there may be diversity within the calibration of this test because of the population was testing, even if you're an outlier within that particular population.
Yes, that's very true.
So now I think it's always important to understand the difference between research and testing that comes from research and clinicians like you, Dr. Winfrey, because in many cases, a good clinician is going to be able to come to a diagnosis, even though the testing is not providing the conclusive data about whether or not you, in fact, for example, have Lyme disease, right? And that's really where a good practitioner is important. And that's why we get to this point where we start talking about data points and the importance of having a relationship with a good practitioner, because it's really the clinical diagnosis that's significant. And you can only get a clinical diagnosis from a clinician who's going to take into account all of the data points and all of the clinicians' experiences, and including, for a good practitioner like you, the intuitive information that you're going to mine from your patient.
Yes, absolutely.
So now let's talk about the gut a little bit more, because one of the challenges that we just talked about was if someone is gaslit and there are neural pathways that are now fostered or developed as a result of the gaslighting, that's going to have a certain psychological impact on the intuitiveness or the what I'm going to again call the onboard diagnostic system. But now we have a different factor I'd like you to focus on, which is what happens if we, for example, change our gut microbiome as a result of taking a lot of antibiotics. We use a broad spectrum antibiotic, and now we've now altered our gut health. What impact is that going to have on the impact of our ability to read our signals from our gut, and our ability to interpret that when we're providing that information to our clinician?
Yeah, I think that's a really good point, and I think that sometimes the use of antibiotics can alter your gut microbiome to where you might shift toward a dysbiosis. You may have an overgrowth of a certain species of bacteria in the gut, and that really alters things. And you might can better understand now when someone says you're FOS. It has real sort of meaning that when we're just full of it in our conduct and our way of being, then that oftentimes is a real clue that something is off in our gut. And that when we have a really cleaned out gut and balanced gut, people tend to be less or not very much FOS. And so if I was to be just very crass and just answer your question that way, I would say that would be the consequences of sometimes using antibiotics and things of that nature.
Yeah, or just so whatever. So now, and the reason it's important, I just wanted to use these two examples to help our folks understand that when we're not feeling well, we're feeling off. Our gut is telling us that we're off. It could mean that our clinician is wrong about the clinical diagnosis that's beginning to develop. Or it could be that our gut is off, or it could be that our neural pathways are off. It could be a lot of different things, which is why we have to leave that space, as you suggested, for this data point to be considered a data point. But it may just be this data point about not feeling well or feeling off, I think is the way you described it, really may be more a description of what's happening with our gut biome, or it may be a psychological response to an unhealthy neural pathway that's developed.
Absolutely. I definitely think all of those are possibilities. And I think that, when we shift our microbiome, I think one of the things that is important for people to keep in mind is that the microbiome is all over the body, not just only in the gut, and that these very small species, we have actually more non-human cells in and through us than human cells. And so therefore it gives primacy to the importance of these sort of cells to us, and keeping them preserved and intact is critical to our communications within our body and without our body. And that these organisms are very, very old, and they carry a lot of sophisticated information in them. And that information can't be processed very well with all the toxicity and the disruption that they experience with our actions and the way we go about it. And I think that we want to, in some ways, preserve the integrity not only of our body, but also of our functionality. It would be important to kind of honor that.
I'm sorry, my spoiled dog is in here, but it looks like she has walked out. So I apologize to our listeners for my dog barking in the background. So I want to stay with the gut for another couple of thoughts, and that is that a majority of our immune system is in our gut, and that makes sense because our gut is the place where we interact with the outside world, right? Everything we eat comes from the outside world. It comes into our gut, and it gets processed in our gut. So of course we have to have a strong immune capacity in order to remain healthy when we have all of these outside things coming into us. Now, can you talk to us about how the gut microbiome being negatively impacted by, it could be a number of different things, but including the use of antibiotics, is going to impact our ability to manage the stresses of outside bugs coming into our system and impact the way that our brain is functioning.
Yeah, I think a lot of the bacteria in the gut are responsible for different things. They're responsible for digestion. They're responsible for metabolism. They're responsible for regulation of inflammation and metabolism. And so when they are preoccupied with handling things that are toxic or things that are not good for them, then they spit out as a product things that are not good for our bodies. But then when they are in some ways able to take in things like, hypothetically, like fiber that is good for them, then they can spit out products that are beneficial for our body, like butyrate, for example. Some bacteria make butyrate, which it helps to fuel the gut cells and then brain cells and things in general. And so when they're healthily functioning, they not only can produce things that are healthy for us, but they can also signal and communicate back and forth with other bacteria, a part of the other microbiomes that can really produce, a little more rhythm and synergy. I think that one thing I might say, because sometimes antibiotics get most of the attention when we're talking about destruction to the microbiome. But for the many people that I've heard say, don't everybody have mold toxicity? Why do I need to get the mold out of me? In mold everywhere. What's the big deal? Yes, you show me a test to show I have some mold or something, but what's the big deal? Germane to this point, I would say, for the people who care about their gut, one of the things you want out of your gut that is hurting your microbiome is mold. That the products of mold, the mold toxins, are antibiotics in themselves. They kill bacteria. And I think it would be important for people to also see that correlation. And then the other point were chemicals, many chemicals that we're consuming, not only on our food, such as pesticides, but other chemicals that we're putting in are also deleterious or destructive to the microbiome as well. So I would just make that one little plug there, that for the people who are on the fence about their practitioners say, hey, I should deal with my mold if I want to get my Lyme under control and in check, I'm not so sure if I should do that. You probably want to maybe take heed to that.
Dr. Winfrey, real quick, what are your thoughts on the study that came out this week? And I'm probably going to butcher the antibiotic name, but it's piperacillin or piperacillin. I'm not really sure how to pronounce it, but it's, came out of Northeastern, and they're saying it's a much more effective antibiotic at killing Lyme bacteria. And they're hopeful that it might help some people in the post-treatment Lyme disease syndrome community or chronic Lyme community. And it does not have an impact on the gut microbiome like doxycycline. Is that true? And what are your thoughts on this study if you've had a chance to look at it this week?
I have not had a chance to look at that study yet, but given your commentary, I certainly will put it at the my priority list.
Great.
So let's talk a little bit more about the gut-brain axis. And there's the vagus nerve is something that many people in the Lyme community focus on. And in many cases, when folks are feeling anxious, they try to use vagal nerve stimulation. So you can talk to us about this nerve and the connection between the gut and the brain, and how important it is to be aware of I guess, tools or protocols that you can use to calm the overactivity of the vagus nerve.
Absolutely. So the vagal nerve is a part of the autonomic nervous system. And one side of that system is the sympathetic system, and the other part is the parasympathetic system. And the parasympathetic system is regulating rest and digest. And that is the vagal system largely. And there The other system, the sympathetic system, is the fight or flight system that's regulated largely by adrenaline and cortisol and other sort of stimulants of that regard. Because people who are going through infections like Lyme, or where their stress genes have been activated by the toxicity and they're under chronic stress, they're going to be tapping into their stress system a lot more, their sympathetic system, and it's going to put them out of balance with their parasympathetic system. And they're going to have, in some regards, low vagal tone. The vagus nerve is cranial nerve number 10 that's coming out of the system with the rest of the cranial nerves out of the brain, and it's coming down the neck and the cervical area and into the rest of the body, and it's spreading out into organs. And each organ, you have a vagal input and then a sympathetic or parasympathetic input and a sympathetic input into each organ. And so that means then that if an organ is constantly getting sympathetic input, it doesn't have the counterbalance of the parasympathetic input, you're putting a lot of stress on the organ that over time would lead to various dysfunctions in that particular organ. And so it isn't one of the treatment modalities and things or thought process to be to think about in terms of activating that parasympathetic system, training it, strengthening it, and having that sort of counterbalance to the sympathetic nervous system so that you can allay the stress response on different organs and the overall function. One thing that people might not be aware of, that where your vagal nerve can become dysfunctional, is with chronic inflammation in the brain that we see in Lyme disease, or if you had some sort of cervical neck dysfunction, maybe you had a car accident or a whiplash or a concussion where there was compression on your cervical nerves. And then down in the spinal column, the other portion of the vagal nerve is down at the sacral area. So people who often fall on their buttocks or have a lower back injury can develop damage or dysfunction to their vagal nerve as well. And so sometimes the treatments that can be very helpful for this are some of my osteopathic colleagues. OMT, osteopathic manipulation therapy, can be very helpful to helping those sort of compression points or the dysfunction along the spinal column and helping to alleviate the strain on the vagal nerve that can be helpful. Other sort of things from a chemical level that can be helpful, B5, panthenoic acid, helps to begin to make acetylcholine, which is the primary neurotransmitter secreted by the vagal nerve that helps in that parasympathetic response. And then there are a lot of other non-pharmacological techniques thought about in the polyvagal theory that people can do, where they use gargling methods to strengthen the vagal tone in the back of the throat, where you get that gag reflex, cranial nerve number 10, 9 and 10, or where you can do various treatments with your eyes and moving your neck and things of nature, training over time to strengthen the vagal tone. Now, depending on the degree of damage or the impact, as I was just laying out there, will influence kind of the impact of the treatment. So if you got compression on the nerve, or you got some sort of structural component to it, you can do those other treatments. It's not going to do as much. You're going to need to really alleviate that more structurally to kind of get the impact that you're looking for. But this is something to take into consideration to addressing the vagal nerve.
Okay, so now, and thank you. That was great. So now I want to talk to you about the sympathetic versus parasympathetic expression of the nervous system. Now, would you be comfortable with describing the sympathetic expression of the nervous system as the triggering of your survival software?
Yeah, I can accept that.
Okay. So, and when your survival software is triggered, your brain is then, of course, now looking for threats and trying to protect your body from threats. And as a result of you're now being triggered into the sympathetic expression of your nervous system, other body functions are beginning to shut down. For example, the immune system is now, if not being shut down, certainly suppressed. Your gastro system, your gut is now being altered. Everything is now focusing on locating and responding to threats rather than your body healing from whatever it is that is ailing you from Lyme disease. Would you agree with that argument?
Yes.
Okay, so now, whereas if we have a parasympathetic expression of our nervous system, that's when we are more relaxed. We're not, our survival software is not being triggered. The stress hormones are not teeming through our system, and now our body is functioning more normally. And as a result of it functioning more normally or more calmly, now the healing processes can take place.
Yes.
So now, let's talk about how first the gut health can impact the signals that are going from the gut to the brain, and now trigger us into the fight or flight, or the sympathetic expression of our nervous system, and now impact our body's ability to respond to microbial threats, meaning our immune system cannot properly respond to them.
To make sure I'm following your question. So how the relationship or the role of gut health and our body's ability to regulate our sympathetic stress response.
Correct. I mean, I guess my question is if we don't have a healthy gut microbiome as a result of having mold, for example, or having damaged it because of anything else, could be use of antibiotics, and I certainly don't want to sound anti-antibiotic, because I'm not. I'm very pro antibiotic used properly. I think it's a great technology, but and then the signals that are going from the gut to the brain make it more likely that we'll be triggered into the fight or flight response, therefore making it more challenging for our body to heal.
Yes, yes. So I think when we think about the intricacy of our gut and all that's going on there, certainly we have a lot of room for things to go wrong. So let's think about one of the key things, I think, is let's just deal with digestion first. And when we're in the stress response, we're not going to be digesting very well. We may, one, not have an appetite. Two, we might have pH changes in our stomach because of that. Three, we may have reflux challenges where the sphincters are not closing very well, the esophagus, and that the pylorus duodenum connection. We may not get proper bile production. We may not get proper digestive enzymes and production from our pancreas. And then as we go on into our gut, we may have damage there where we may not get really good absorption or further digestion all the way down. And then we may not get good motility to be able to push things down and out. That means that a huge component of our system is not working properly, that's out of whack, and we need that system really to help. And so you got all this toxicity just sitting in the gut. That toxicity there is just impacting the immune system. And then the information from the enteric system is taking that information, the toxic communication, up to the brain, and then it's sending, kind of toxic signals, if you will. We're living in a day and time where the word toxicity is being used quite a bit, and we're using the word toxicity in the context of personalities. We're saying people have toxic personalities, or toxic masculinity, toxic feminine, all these sort of things, toxic work environments. We're using the word toxic quite a bit. And I think in some ways, if we're talking about toxic communication, toxic communication styles, et cetera, that tells me, if that's happening, that there's some toxicity going on in the body, and that is interfering with processes and communications and signals within the body that is then coming out of the body. And so I think that one such thing is, let's go over to the liver some. If the liver is not able to process well, there's toxicity there that's now building up, and the liver can't break down things very well, then that toxicity can build up and go back to the brain and interfere with communication. So one sort of way that we see that manifest is rage. Sometimes rage is a toxic liver response. And so if toxicity is building up and the liver is congested and it can't really process things through, one sort of source of understanding what's on the manifestation of that is rage. And so when we see somebody with rage response, one thing we might think about, here is your question. The immune system can't function properly well if all of this is not functioning well. And so if a lot of the immune system is in the gut, as you was indicating earlier, then if the gut is not working properly because there's a stress response and it's on this sympathetic drive, then the immune system is not getting the proper signals and the communication it needs to do. And then if we're talking about in the context of Lyme disease, now you don't have that much support of your immune system to help fight off this infection. Yes, treating with antibiotics is important and a real thing and a good thing, but you also want to have a strong and robust immune response to really help that process as well. And if it's blunted for multiple reasons in this moment, thinking about the sympathetic drive being overly stimulated, then that's not going to be faring well to the person that's trying to recover from this process.
So let's now talk about the, instead of from the gut to the brain triggering the sympathetic response, let's talk about the brain itself and what could be going on in the brain that could likewise trigger the sympathetic response and have a patient find themselves almost constantly in that sympathetic expression of the nervous system, and therefore having a suppression of all these important functions. So for example, we talked a little bit earlier about being gaslit by either medical professionals or friends or family, and sort of toxic. You brought up the use of the word toxic in a social context, and I'd like to explore that with you, because what my understanding is, and please correct me if I'm wrong, is that the problem with having toxic social interaction, whether it be a doctor, a family member, a friend, a partner, is that it will create neural pathways or shortcuts, and as a result of having these toxic experiences and these unhealthy neural pathways, it may make us more fragile and more likely to be expressing having our nervous system expressed in the sympathetic expression as a result of coming in contact with other negative things in life, and therefore put us in a position where we are immunosuppressed because of the social trigger of our sympathetic nervous expression.
Yeah, so those two questions. So the two questions I heard was the role of how the brain is impacting the gut and that signal down, and how the mind-brain sort of component affecting that signal down. And then the second question is in the context of gaslighting or other toxic communications or experiences or relationship, how that then impacts our stress response, that then impacts our immune response.
Yes, thank you. Thank you for clarifying my verbose question.
Yeah, so I think that one of the, coming back to the cranial nerves, cranial nerve number 10, the vagal nerve, is coming out of the brain and is coming through the skull and down the cervical chain and down into the body. And so if we in some ways are experiencing Lyme disease, where it gets into the brain and the nervous system, particularly in tertiary Lyme, and it's creating this robust inflammatory response in the brain. So this brain is now chronically inflamed, that the bug itself and the chronic inflammation over time creates damage in the brain. So it's damaging down nerve tissues. And now these cells are in a fight for their life. And they send these signals down into the body to say, hey, we're under attack. We're in a lot of stress here. And now you're getting this huge stress response in response to that. I think that Lyme can do that all by itself. The other sort of component that is that Lyme, like many of these bugs, they love the limbic system, which regulates your emotions and your experiences. And now you get a flurry of old experiences that weren't bothering you anymore. Now they're flaring up all of a sudden. Now you're having these fights with your partner or so, that about something that happened 10 years ago that didn't happen. Or it could be something that happened recently is just kind of amplified and supercharged because of that chronic inflammatory process that's there in the brain. And so now you have this sort of communication. Your brain is now sending these signals down to your adrenal glands to signify the distress. The adrenal glands are now pumping out all these stress hormones in response, and it's saying, alert, 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 you're in danger, you're in danger. The difficulty with this is because it's covering so many grounds and so many things appearing as danger, it's hard to kind of identify what exactly is the problem. And it seems like sometimes everything is the problem and everyone is the problem. And I think this is where we get into some of the complicated situations where people get into suicidality as a consequence of Lyme, where they say everything and everybody is a problem. The best solution for me not to be here. That sort of pathological thought gets created sometimes in that context. And I think that when you're in an environment where you can't have the empathic response where somebody reflects to you what's accurately going on, you then get some gaslighting where somebody's reflecting a response to you, oftentimes in the context using denial or invalidation. It then makes you feel even more threatened because it sends a signal to you that, oh my God, I'm in danger and no one else sees this. And it cuts off your feelings of being helped by a person and you feel more helpless. And that helplessness then drives another stress response to where now you feel I have this heavy burden that I'm carrying around and no one understands it. That's the first one. I can turn to no one. I don't know where to go and no one's going to help me carry it. And I'm all by myself and I'm alone with this huge burden, this process. In fact, somebody's telling me it doesn't even exist or that it's all in my head. And so you have all of this kind of coming in and it's constantly driving more and more inflammation, inflaming the process even more. And now this problem has skyrocketed into some huge conglomerate of a problem. And it feels just massive trying to deal with all by yourself. And you don't have all the proper understanding. That's a lot for any one person to handle and take on. That's a lot for the body to try to handle all at once. And the immune system then takes a taxing as a response to that. And it's trying to robust a defense response to amount of a defensive response. And over time, it just can't keep up and it poops out. And then one of the things we can see, for example, in blood work, we'll oftentimes see immunosuppression. We'll see the white count being low in people. And I kind of see that quite a bit. A low white count, sometimes neutrophils, oftentimes lymphocytes, and other sort of components of that process in a person who is just really, really beat down and burdened and chronically stressed. We see that correlation quite a bit. And then sometimes with treatment, we'll see the person feeling less stressed and less beat down as the immune system is rebounding and coming back up. And so that sort of chronic stress response on the immune system takes a huge toll.
Dr. Winfrey, I'm going to jump in here, Rich. I just want to pull you out for 1 second from the brain and focus on a quick question, because what you just said, Dr. Winfrey, is something I personally experienced greatly. I mean, it's almost like you were sharing my lived experience for quite a while with Lyme disease. And I think everybody listening to this podcast can relate to what you just described so well of what we all go through. So what are some tips and tricks from a treatment standpoint or an herbal standpoint or anything you can point out to help people that may be listening to this podcast and going through it in that deep, hell that you just described of being gaslit, feeling that nobody understands you and just feeling that feeling of despair? What are some tips and tricks you can recommend before Rich picks back up with some of the fun brain discussions that we're having?
One of my more important thoughts that I want to share about this, I think this is the most important, is that the human body is very intelligent. The human body is very sophisticated. It does not prioritize things that are unimportant. It does not waste times with things that are insignificant. And so if something's coming to you, some communication, some signal, some thought, it has some importance to some degree. And it's important that you honor that. Of all the million things your body could do, all the million thoughts that your mind could think, why think this or why do that? And it's selecting that for a particular reason. And so if you can honor first and foremost that it's sophisticated, it's not wasting time or wasting energy doing something that's unimportant, that will give some clue to find validation in what's happening. Number two, the body has safety and check mechanisms. And if you've gotten to a point of despair, suicidality, that means your safety mechanism have broken down. That these sort of thoughts are pathologic, meaning they are an alarm response that you need to do something, but not to act on it. And the body is sophisticatedly organized in a way to preserve itself, not destroy itself. And so if one is getting into a place of self-destruction, it is important to honor that is not you, and that the bug has hijacked you and put you into that state of being and having your mind think those particular thoughts, that those are not actually your thoughts. And had you not been in this situation, you would never even think the thought. And so the Lyme is very sophisticated, knocking out these check and balance systems in the body and knocks them all out to the point where you feel very defenseless. And so when you get into a situation with a practitioner and you're feeling gaslit like that, that is a sign, if you're having a very visceral response, that your safety mechanism is completely off. And that is easy for that sort of situation to be so triggering in that sort of way. In that response, I think it's important to recognize that you're defenseless and vulnerable. And the first thing that needs to be done before any action is taken is to fortify yourself and to rebuild a defense mechanism. And if you can't do that internally because your systems and everything is off, you need to first fortify yourself with friends and loved ones, beliefs and communities that can kind of give you that fortress around yourself until you can rebuild that internal defense signal and mechanism so that you can then take decisive action.
So Dr. Murphy, if in fact we agree that that the sympathetic expression of our nervous system is survival software, I think it's also important for folks to understand that that the voice that they're hearing is not their voice. It's actually survival software. And although it sounds like us and it sounds like it's our voice, it's really not us. It's the survival software that's going off and signaling to us what it signals to us when we're under threat.
Yeah, I think that, you know, the way someone in survival speaks is not the way somebody that's not in survival, the way they speak it. And survival has a certain language to it. And I would agree that it speaks a certain way. And the language of the adrenal glands is one of defeat. And so when I hear one speak defeat, interpret defeat, imagine defeat, that tells me their adrenal glands are pooped.
Okay. I'm so happy you're there, because that's, see, so part of what we've been developing here, and that's why I love you as a psychiatrist as opposed to some of the psychologists we've interviewed, is that there's a physiological foundation for these feelings that we have, right? And one of the things you just developed for us is this loop that develops between our gut and our brain, where either an unhealthy gut now creates an unhealthy brain, which now signals unhealthy, creates more unhealthy gut, which then creates a more unhealthy brain, which and we have all these really unhealthy signals going back and forth, which are now making us more fragile and more sensitive to external triggers, and we find ourselves living in the fight or flight phase, or we're just constantly dealing with our survival software, and it has an impact in all kinds of places, including, for example, our ability to sleep. One of the things we talk about often here with guests on Tick Boot Camp is that we have this tired but wired experience where where a Lyme patient is exhausted and they're about to go to bed, and then they just can't fall asleep. They're just wired. We've had some folks send us videos where they're bouncing up and down on their bed because they're just wired, right? And that's happening because their central nervous system is still wired. It's still taking off. We're still in the sympathetic expression of our nervous system, which then of course makes our brain unhealthy again, because when we're not sleeping, our brain can't detox, and the glial system can't, lymphatic system can't drain, and now we have more brain toxicity, which is then again looping into our gut, and it's just going back and forth. But we just have this really, really unhealthy physiological set of events that's causing us to be stuck in fight or flight.
Yeah, absolutely. One of the
So,
one thing I want to add about divorce, I really want to impress upon people that bacteria carry DNA and information, and they have a computer system too, and their computer system links in with our computer system in the body, and when it comes to the nervous system, can then impute or impart that sort of computer information into the brain, and particularly into our thoughts and feelings.
I love that. I love, I'm sorry.
It would be important for people to understand, because we're living in a day and time where people want to desperately understand why they think what they think or do what they do. And for those that have Lyme disease, and particularly people who are on the fence or whether or not they should treat the Lyme and different things of that nature, you should know that that thought may even be coming from the Lyme bug itself. That the survival of the Lyme bug will impute a thought into you and make you think not to treat it so that it can stay alive in you. It has a parasitic nature. And so I think that some of the thoughts that we're thinking, and people who have recovered can attest to, a lot of the thought process they had when they was heavily infected is not the thought process they have now when they recovered. And that would be important for people to understand this sense of me versus not me, and how you can get into this sort of the social state of mind where you're operating under the guise of the bug and how it's hijacked the brain, and this is not fully you. And I think in efforts to recover you, you can't fully know who you are while that bug is still there, influencing you to think what it thinks. And because of the old nature of this bug, I've had patients say they had thoughts that they don't quite understand because it came with experience that they didn't even have. And so, you know, how does one come to a sense of thinking about who they are when that is happening? So you have that going on. And then you have people saying, kind of coming in with friends and different people. You have people saying, well, you're not who you are. You've changed. You're not the same person. The way you're thinking the same. And now this person is like, you know, feeling disconnected from friends and things of that nature too, which is a whole nother loop of this. And so sometimes people become alienated from their families. And much like the lepers in the Bible, sometimes Lyme people get together and form a Lyme colony. And they can find some solace with that. But now they kind of disconnect from people who, quote unquote, don't have Lyme. And that becomes a whole nother component to the stress response where I am who I am or what I am, and no one understands me or no one can get me or what's going on. And so you have it from the medical community, you can have it from family and friends, and then it can just drive this state of loneliness and profound despair.
Wow. I really love the way I'm going to use different terminology, but earlier you taught that we are largely a bag of bugs, and we're more non-us than we are us, right? We have more, bacteria and viruses and protozoa in us than we are us, right? And it's that relationship between the bugs that we are carrying and us that is going to cause us to be physically, emotionally, and spiritually healthy or unhealthy. And I've not heard somebody describe the signals that are coming from you. You were calling it a computer, but I might describe it a little differently as the software in a computer, right? And the bugs in us have software. Some of our software, some of it's going to be software that's going to be helpful to us, and some of it's going to be software that's going to be unhealthy to us. And I really love the way you describe the way the Lyme bacteria is going to have software that's going to send signals to us that are going to cause us to hear what sounds like us, but we're going to be hearing the triggering of survival software that's not going to serve us. In fact, it's going to hurt us and serve the Lyme bacteria itself.
Yes, absolutely.
That's really powerful. Thank you. That's really powerful. So can you talk to us about the HPA axis? Because one of the things that I have personally come to understand, and I've also witnessed this in Matt, is that we were in this hormonal loop triggered from our brain to our adrenal glands and the I guess pituitary gland, then the adrenal glands, and all of the stress hormones that were teeming through our system. And at least what was happening with me is my cortisol receptors were impacted, and I had adrenaline running through my system. And it wasn't until I started using an herbal protocol that modulated my cortisol receptors that I started to calm down. and I started to have a more healthy immune function, and I guess a more healthy expression of my nervous system. So can you talk to us about the HPA axis and how once that axis is triggered, how you could get stuck in this now hormonal loop that causes you to be spending too much time in the sympathetic expression of your nervous system.
So in some sense, the HPA axis stands for the H stands for hypothalamus, the P stands for pituitary, and then the A stands for adrenals. And so that axis is a communication pathway that releasing hormones from the hypothalamus influence hormones in the pituitary that then influence hormones in the adrenal glands. And in the adrenal glands, there are 4 large sections. It's the mnemonic, or the way of memory, is salt, sugar, sex, and then the stress response. And so the salt stands for your mineral corticoids like aldosterone, your glucocorticoids like cortisol, and then your sex hormones like DHEA, testosterone. And then you have in the medulla part of the adrenal glands, you have your norepinephrine and epinephrine production. And one of the things we see in Lyme is the chronic inflammatory response in the brain, for example, heavily triggers this sort of pathway, and where it's just pouring information down to adrenals, and it's telling the adrenals to kind of just pump out stress hormones. And in the early stages, what we see, for example, an acute stress response or a chronic stress response, we see elevated levels of cortisol. We can see that on a saliva cortisol test. And then over time, when that signal gets weaker, the person is producing less and less cortisol throughout the day. And sometimes in the wired per tired sort of category, there is a elevation of cortisol, let's say at night, where this person gets what is called a diurnal pattern or a second wind, where cortisol drops by 50% throughout the day at 4 critical points from the time one wakes up in the morning to noon to 6 and then 10 at night. But some people, they get a second wind and cortisol pops back up at night. So it makes them like more wired, but other parts of their body is telling them that they're tired. And that then drives for people a stress response that kind of keeps them up, and they're stimulated and they can't sleep, as you was indicating earlier. And that definitely is not good for people who have Lyme disease. Sometimes in people, the memories and thoughts are some of the triggers, like the bug or the inflammation is, to this HPA axis. And the inability to regulate stress or regulate the sympathetic nervous system makes some thoughts and things more triggering or more difficult to manage, certain experiences for some people. And so we want to have an adequate response of cortisol to a moment, and we want to be able to turn it off when the moment is over. But for some people, the moment is over, but the response continues. And and people say, I just can't calm down, I just can't relax. And well, what's bothering you? I don't know. I can't really identify something that's bothering. And what might have been bothering may have been triggered hours before, sometimes days before. They can't really turn off the response. And this is very disturbing to experience, because when we're talking about a hormonal experience, we want to turn on a hormone at a certain frequency and a certain rhythm, and we want to turn off at a certain frequency and a certain rhythm. And that gives us clarity of our experience and clarity of understanding. But when we're constantly having a response and it stays elevated, it's giving us input into our mind to interpret as this thing is still going on. And that can be very confusing and disorienting. And so I think some of the craziness that people think when they have Lyme disease is coming from all these, one response from these sort of aberrant hormonal patterns that are not turning off when they should. And so to your response, when we come in and we try to regulate the sympathetic response, we're using adaptogens and other sort of hormonal sort of components if they're low, or we can use adaptogens like ashwagandha and things like that when they're high. We bring some regulation to that system, and then the person can feel like their experience makes sense to them. And so I think that's definitely critical early on in the experience. A person is going to definitely be successful in recovering.
Dr. Winfrey, real quick, I'm going to steal another quick question here, Rich. The adaptogens, what do you recommend for people that are listening that are really feeling overwhelmed and overstimulated? It's probably one of the top three things we get is I'm in fight or flight. I can't calm down. I don't know what to do. Nothing is helping me. And, Rich and I mentioned that we take Dr. Rolls's, HPA balance, but, I've also done now recently, Rich knows passion flower is another one that I've used. What are some things you can recommend to people that are natural herbs or natural adaptogens to help people regulate their nervous system and calm down from that fight or flight response?
So that kind of depends if we're seeing, for example, if they have high cortisol or low cortisol. If it's high, we want to take things to bring it down, if you will. And if it's low, we want to take some things to try to bring it up. And in some instances, that knowing that difference is important, because if your stress response is really high on lab, for example, you're going to feel really wound up and you're going to feel intense. You're going to be head on swivel and you're going to feel really anxious to your experience. But if it's really low, you're going to feel the same way, but a little different. You're going to feel oftentimes overwhelmed by things, and small things are going to bother you. And you're going to feel like most things are big, and you need to go and take the trash. And be like, oh my God, I got to take the trash. And like, you're just going to feel so defeated even before you start. And that's oftentimes because you're not producing enough compared to the person that's producing too much. And so knowing what state a person's in is going to help, dictate kind of what you do. Now, the concept of adaptogens means if it's high, you bring it down. If it's low, you bring it up. But it doesn't always work that way. And so sometimes we have to, when it's low, come in with cortisol support supplements. If it's in a mild or moderate category, we use adrenal glandulars that have the cortex in it. We can kind of get those sort of things, or sometimes the whole one. Or sometimes a person is kind of stage 3, stage 4 adrenal burnout, well, we might have to use hydrocortisol, just use kind of replacement, cortisol replacement supplements and things of that nature. Especially we see this if somebody has complications of POTS, where we might need to add in things like mineralocorticoids, like fludrocortisone, to kind of help with those sort of responses. As it relates to when adding on adaptogens, some of the adaptogens I like, one of my first go-to is ashwagandha. It's tried and true. It's been around for a long time. It's cheap and easy, and majority of people respond to it and like it. I can use it throughout any part of the day for sleep or whatnot. I like phosphatidylserine, particularly if a person's got some cognitive sort of challenges as well. They can take that particularly to help bring it down. Oftentimes we see if the person's over 25, 30, their DHEA is oftentimes low in these sort of situations. DHEA is a counter to cortisol. So we see elevated cortisol, can use DHEA to really help, particularly at nighttime, and it can help a lot of people sleep very well. So I like those. Now, you mentioned passion flower, you mentioned motherwort. There are a lot of others, rhodiola. Those I don't find I can't say that they always work in everybody. Sometimes they work in some and not in others. And so I certainly like them. And it's going to be a little bit of a trial and error with people, kind of depending on their response pattern. So I'm open. My philosophy is anything that works, I'm open to it. So I keep everything on the table and we just see how it goes.
Quick final question on this topic. So I think an important note, we've had other people come on and say adaptogens by nature are modulating, and therefore if your cortisol is low, it's going to help bring it up. If you're too high, you're going to help bring it down, right? You're going to balance you out. But I think you said that it doesn't always happen that way. So we can't just willy-nilly go trying some of these adaptogens because it might not work, and we really should know where we're at and then give ourselves the specific support we need. So is that a general rule of thumb where we really need to have this data before jumping into an adaptogen?
Yeah, I think so. I think it's, let's say someone's at stage 4, like their cortisol just bottom out. They're not producing much adrenaline. Their blood pressure may be low and things. The cortisol is really low. This is a situation where I'm going to probably get in some adaptogens and things, but I'm really going to bring in hydrocortisone or something like that to try to get them up and out of bed. And I'm quickly trying to get that up. And then I'm going to be checking their temperatures. I do something where I have patients check their temperatures at 3, 6, and 9 hours after they wake up. But in the stage 4, like people, they may not be waking up too easily. And so if I can get some temperature checks out of them, daily average temperature, about 5 days, that helps me to evaluate their thyroid and their adrenal response. If the temperatures are fluctuating all over the place, that lets me know that the adrenals are still off. And if their temperature is not at 98.6, that lets me know that thyroid is off. And so I'm using that to help me gauge this sort of process. I want to quickly get them stable on the adrenals support so I can then get into thyroid so I can get their body temp up and then get their energy up, which is one of the most critical things that's impaired in Lyme is the mitochondrial dysfunction, the loss of energy.
So I want to thank you for actually raising something that I don't think we talk enough about, which is that we generally focus on cortisol being a stress hormone and the impact that it has on our ability to fall asleep, and it of course having that whole scenario of tired but wired. But there is the other piece that you just, I think, thank you for really powerfully describing, which is it's an important hormone to wake us up, right? And one of the reasons why we can't get out of bed is because we don't have a high enough level of cortisol. And cortisol is a really, really important hormone. It's a really great hormone because it's what the levels increase as we're about to get up in the morning. And if folks are having trouble getting out of bed in the morning, it's probably, or it may be, because of inadequate cortisol.
Yeah, so that relationship is really important. Cortisol and melatonin is on a rhythmic cycle. And so what we see is that as cortisol is emerging in the morning or this way, and then we want, melatonin to be coming down. And so the person can kind of, the melatonin's wearing off from the sleep and then they're able to wake up in the morning. But what we see sometimes is the opposite, where people's melatonin is still pretty elevated when the morning time comes around and the cortisol is low and is not mounting a response. And so your body starts to make cortisol in the middle of the night, and then it's slowly starting to merge more and more until like around 6, 7 is at its peak, and then it stops being produced around like 12 noonish. And then you got the rest of the cortisol you need for the rest of the day. But in Lyme patients, that's not what's happening. And oftentimes this sort of cycle is reversed. And so we can either see a combination where cortisol is too low and they're not waking up. We can see melatonin still high, and that's another reason why they still sleep. Or we can see melatonin not being produced enough, like at night, and they can't get to sleep and cortisol is still too high. So we can see a lot of different variations. So yes, having a test kind of gives us that information and kind of let us know where we need to make interventions and how we need to use treatments to counter one thing or promote another thing to try to get these hormones back in balance first and foremost so a person can get going. I like to think this is kind of the first step before we do anything else, before we even get to antibiotics, because we need the person to be able to mount a response and to have energy. The second part, I think, for cortisol that people need to know is that if you're trying to get your mitochondria back up and get energy produced, you need cortisol and thyroid hormone, because it's a two-hit sort of key into the mitochondria to get energy up and going. So if you don't have cortisol, you can't really make energy along with thyroid hormone. And sometimes that's the reason why thyroid treatments fail. There's not enough cortisol there.
So now that we've laid this foundation for the physiological expression of our nervous system, I'd like to now step back and talk about the psychological expression of our nervous system. And one of the things we talk about often on this podcast is the cybernetic loop of our beliefs triggering our thoughts triggering our feelings triggering our actions giving us our results, which then reinforce our beliefs. Now, we could have beliefs that are not serving us, or we can have beliefs that are serving us. And I'd like you to give us some help in understanding how now these physiological processes that you've just described for us are now expressing themselves psychologically with having thoughts that are not our thoughts. Well, it's certainly not healthy thoughts that are supporting us. Now, you gave me a new insight today that I hadn't had before, which is these are thoughts that could just be survival software. These are thoughts that could be the bugs, the bugs thoughts, which are now triggering us to feel either good or bad, right? Which are then triggering us to take actions that are either going to be supportive or not supportive, which then are going to give us these results. So can you talk to us about now the psychological expression? I guess I have two questions. First, did I describe the psychological expression of the nervous system properly? If I didn't, please correct that. And if I did, can you now make the connection between these physical challenges that we've just outlined and how they express psychologically?
Yeah, so let me first address the first part. So oftentimes we're talking about thoughts or beliefs shape how we feel, and then it shapes a behavior response, and then a pattern, and then a habit, and then a behavior. I would say a little differently. That's more of like a top-down sort of thing, and that's suggesting that things are starting with thoughts. Before thoughts are emotions. And I would say our emotions are physical. We can measure emotional responses on a PET scan, for example. We put a person in a PET scan, we can see their body light up in different ways as they have different emotions. Emotions and feelings are different. Feelings have a conscious interpretative aspect of the emotions. And so emotions are more bodily or somatic or visceral or more close to our physiological sort of makeup. So what do I mean by that? Let's take a baby, and that baby was treated very well. Good attachment, fed properly, clothed properly, temperature regulated properly, digestive system regulated properly. That baby had a very secure attachment, felt love, felt warm. Now, the baby's not going to know it's feeling warm. They're just going to know that it was physiologically taken care of. Coming out of the first year of life into the second year of life, etc., that baby is going to be more likely to think thoughts that are positive toward, let's say, the mother. Now, no one taught the baby to think that thought. Well, how did the baby come to the thought? It came first through the bodily emotional response patterns from the mother and how the mother nurtured and cared for the baby that then led up to thoughts. Now you take the opposite of that. Let's say a baby was mistreated, abused, neglected, left to fend for itself at times, not properly clothed and nurtured and things. Now the baby feels agony and turmoil in the body, and that's now going to lead to certain thoughts. So our emotions or affective responses to experience then leads to thoughts at a very cognitive level that then leads us to reinterpret our emotions and what we call feelings that then lead to behaviors that then lead to certain patterns and out like that.
Okay, so but aren't all of those experiences, whether they be positive or negative, creating neural pathways that I think in their totality become your belief system? You can physically see them, and you can, and of course, and the more that those pathways are triggered, you know, they fire together, they wire together, or yeah, and they become you know, physically you know, they become physical, right? And which are then triggering our thoughts, feelings, actions, and results. So we're responding to experiences either positively or negatively based on the totality of those childhood experiences that we had.
Yeah, and so I think here, why this particular point matters, let's say in Lyme disease. Let's say a person has Lyme disease and knows it, and has Lyme disease and doesn't know it, and they're in therapy. The challenges they're going to have here is that the Lyme disease is pressing upon the limbic system where the affective responses are being generated there. And they're in a process that's largely intellectual, and they're trying to change their thoughts and different things, and it's hard because they're trying to change a process that's so rigidly and wired in there with the inflammation in the limbic system that makes it very difficult. And so the top-down approach has a role and can be helpful, is not robust enough to sustain itself without changing the bottom-up sort of approach, dealing with the sort of physiological component of that. And so coming back to your other question about how that then leads to stress, cortisol, one of the endpoints of cortisol is in the brain. So cortisol needs to make its way into the brain and to have an impact on sort of neuronal structures and synapses. And so you take somebody who's chronically fatigued, who doesn't have that, thyroid hormone similarly needs to make its way into the brain. So if it's really low, a lot of times in Lyme disease, the person's not getting a good thyroid signal there. That then is going to influence how you think. People who have low cortisol in the brain think a very different way, and they're going to be more apt to have what you're considering adverse childhood events and experiences because they have a HPA axis that's been chronically in overdrive that then starts to poop out, and they can't mount a robust response. So the next time they have a stressful experience, they can't regulate it properly. And then they start to have these imprints in their mind and their brain. And then they start to now interpret other experiences as they originally was, because they don't have the machinery there to really alter that sort of process much more. This can be very difficult because then that can continue to express itself over years and into adult life, where this person just experienced everything very stressful, and stress responses oftentimes lead to premature judgment, rash decisions, impulsivity, inattentiveness, and that you're not taking in proper information and things of the nature. So you're only taking in pieces of information, conversation, and experiences. And then one interprets the experience of life as not being very good.
So let's go back to the example you've given of a baby who was nurtured versus a baby who was not properly nurtured, right?
Yeah.
And I think we agree that a baby who was properly nurtured is going to have more healthy or supportive neural pathways, as opposed to a baby who is not properly nurtured, where they're going to have more negative or neural pathways that are not going to support them. Now, having these two different experiences, one with a healthy experience, one with a traumatic experience, they'll have two very different brains, right?
Yes.
The
Yes.
brain that is serving the brain of the baby who is properly nurtured is
Yeah.
going to be a brain that's going to be less fragile. The triggers are going to be less sensitive, and they're going to be spending more of their life in the parasympathetic expression of their nervous system, as
Yes.
opposed to the baby who was raised in the traumatic environment, where their neural pathways are going to be are not going to serve them as well. They're going to be much more. They're going to trigger in response to events much more quickly, and they're going to be spending more time in the sympathetic expression of their nervous system, right?
Yeah.
Now, do you believe that it's the neural pathways that have developed that are either supportive or not supportive, or in a nurturing environment versus a traumatic environment, that's going to make someone more vulnerable to becoming chronically ill from Lyme disease?
That's a really good question. And I have two kind of thoughts about that. It's a really good question. My first thought, very simply put, the answer is yes. That if they're already chronically stressed, then it would follow that they likely have vulnerabilities or compromises to their immune system. And then it would likely follow that they would have compromises and vulnerabilities to the entirety of the immune system, which a large part of the immune system is at your skin, right underneath the skin, where a tick bite is going to happen. You need to be able to mount a response right there. And there's going to be vulnerabilities there that will allow the tick, the bacteria, to make its entry into the body and matriculate where it needs to get to. A person who is already chronically stressed like that might also be less attentive or less regarding. And they go out hiking, they say, well, I don't need to take any protective stuff. I can just handle this. They have this spirit of invulnerability. I can see those sort of places. But a person who is used to being secure and feels like being secure is important to them might take more precaution and to handle things more appropriately so that they don't get into harm's way and to preserve their body. So for a lot of reasons, somebody who has early childhood traumas and challenges can predispose them behaviorally, psychologically, and physiologically to an infection with Lyme. And then it can be a more complicated Lyme process because other sort of things such as support systems may not be as intact with these people or not. The other way of thinking about this is, if we're talking about congenital Lyme, where a person, parent has it and has already developed certain stress patterns and things because they've had it, get pregnant, and now when the baby is formed, there's not much of a defense system to the early cells that are forming. The bacteria comes into those cells. It starts to grow with the forming fetus. And now the systems that are already compromised before the baby really comes into the world. And so then that child is going to have a much more difficult time with regulation. And we can see early signs of this in people who have congenital Lyme, like such as colicky behavior, for example, oftentimes, sometimes can be a sign of congenital Lyme. And attachment with the mother and parental caregivers are going to be disrupted. And then their experience with their environment. Let's say They have hormonal imbalances very early, such as thyroid hormone chronically happens. And so they run cold temperatures. They always cold. So now this is affecting their development, having low thyroid function, for example. They're going to have much more difficulties in social interactions, academically, and they're going to have much more stress on it. And then they're going to have much more complicated Lyme journey than someone who contracted Lyme much later in life.
One of the things I also wanted to just sort of call to your attention is that when we interviewed Dr. Richard Horowitz, he had shared with us on a number of occasions that a full 1/3 of his female patients who are chronically ill from Lyme disease had suffered sexual abuse at some stage in their lives. And I'm just wondering what your thoughts are on the impact that the sexual abuse may have on the neural pathways that are causing the victim of that type of trauma to be more vulnerable to Lyme disease.
So you're saying sexual trauma first, infection later.
Yes.
And are you also saying infection later predisposing to sexual trauma first?
I hadn't thought of the second, but yeah, I mean, it makes perfect sense, right? That it could work either way. But I think the way Dr. Horowitz explained it to us is that it was the sexual trauma first, I think, and then the exposure to Lyme, or at least the the increased likelihood of a chronic presentation of the disease.
Yeah, so let's deal with the first one. So two parts, sexual trauma first, and to lead to the vulnerabilities to contracting Lyme, or the Lyme that was already present, it was dormant, can be activated. So sexual trauma is a violation of the body, and it's a threat, a very primal threat to the body. And in this context, mind and body is the same to me. Our mind evolves out of our body, as we were talking earlier about the child that was nurtured or not in the first year of life, for example. So the body's damaged, it's been harmed, it's been violated. That creates a stress response that you spoke about earlier that impairs and affects the immune system. And that then affects brain patterns and stress responses and behavior adaptations afterwards. That might lead one to not trust very well. That might lead one to deny the reality. Oftentimes in sexual abuse victims, they want to deny the shame and the horror of what happened so they don't have to face it. Those sort of thoughts and beliefs can easily pour over into a person contracting Lyme, developing the illness, and then going on to be a chronic Lyme pattern because they don't pair well, they don't relate as well, they don't bond as well, they're not trusting of authority figures or so as much. Their immune system is not as robust as it once was, and it can make it much more complicated. So then, well, how do you work with someone who's had a sexual abuse past and has chronic Lyme? It's challenging because the very thing you're trying to help with them in terms of improving their bodily functioning, that was the source of the problem here with the trauma. It was a battleground for their body. And now the Lyme is a battleground for the body again, and you're trying to help it with treatments like antibiotics, which is going to further harm the battleground of the body. So the battleground of the body becomes oftentimes what these women want to protect. Could be men too, but oftentimes it's women. They want to protect that. And so sometimes they can reject treatment because they feel like their body is being battled over. Issues around autonomy and self-control, agency become primary issues sometimes in sexual abuse victims, that they need the treatment to go a certain way. They need a certain approach or a certain rhythm or pace, can make it very complicated. And so for a practitioner working with patients like that, need to be aware of all those dynamics interpersonally and in the treatment protocols, but also what it means for the body, that they have something that's attacking their body, that's reminding them perhaps of something that once attacked their body very viciously. And that's not so easy to take care of. They could then sometimes develop defensive behavior where they want to protect the bug. If we're talking about some sort of identification with an abuser, oftentimes that can be a complicating factor as well.
I want to ask you one more question about physiological and psychological before we step to the spiritual presentation of the nervous system. One of the things that Matt and I had observed pretty early on in the development of this podcast is there seems to be a connection between prevalence of concussions and chronic Lyme disease. In fact, one time I had joked with Matt that I said I didn't want to be in close proximity to too many people with Lyme disease because I was afraid a piano would fall on my head because it was just concussion after concussion after concussion. Can you give us your thoughts on the connection between chronic Lyme disease and the prevalence of post chronic presentation of Lyme disease and concussions?
Yeah. So it's quite prevalent. The brain, in some sense, for a person that has Lyme first, let's say, and then gets a concussion second. And there's already a chronic inflammatory process that's going. There's already, in some sense, neuronal damage that's happening. The cells have a hard time recovering. Oftentimes we see in Lyme disease, for example, we can see methylation defects or impairment. Methylation is one of the things that's needed to help make myelin. And sometimes we can see stem cells be damaged in Lyme disease. And so that neuronal regeneration is difficult. And so you have this process that's already going on. And then you have a person that develops a concussion. And there's further damage that we can sometimes see on a gross image like an MRI, but sometimes we got to get down to a PET scan or a SPECT scan to really see it sometime. And it adds on top of that process that was already there, and it becomes synergistic. And that further damage leads another inflammatory cascading response that might also activate a mast cell response that further might impair the lymphatic drainage system, so it can lead to more increase in volume of the brain pressure that might lead to disruption of the gut because it disrupts that enteric system that we were just talking about earlier. That then disrupts the microbiome as well, that then impairs, brain recovery. If we're talking about frontal lobe damage as a response to this, which is the area that's most impaired with Lyme, and then the person has a brain injury in the frontal area, then you're just kind of getting a sort of double whammy and double impact. And so it's in these sort of situations, it'd be important to really understand that the concussion was there and there's Lyme disease there, and you have to address both to really get the person's brain rehabbed and back on track. If you're only just seeing it as a Lyme issue and you're just doing antibiotics, then you're not going to be doing those other recovery methods that you need for the concussion, and that's going to be very hard on the person.
And I want to, again, and you've been really generous with your time, and this has been absolutely brilliant. So thank you for teaching us so much. But I do want to get to the spiritual piece. And it's one of the things that I quite frankly was looking forward to talking with you about because we touched on some of that at the ILADS conference. I've shared with our listeners that I am a Christian. I believe that we are spiritual beings having a human experience. And that was something that was further fostered fostered my belief system, actually through interviews we've done on this podcast. And we've heard folks share with us that they've essentially disassociated, that their spirit had left their body and they were watching themselves live the life that they were living. In fact, we had one guest tell us that that her spirit was dragging around this really sick body, and it wasn't until she worked with a therapist that she was able to get her spirit back into her body before she could begin to heal. Can you give us your thoughts on this sort of separation and Matt, correct me if I'm wrong. I think it was called disassociation, where there seems to be this separation where you're watching yourself live your life, and you have to sort of merge this before you can heal.
Yeah, it was a depersonalization, Rich, is what they called it.
Thank you. Yeah, depersonalization.
So the word disassociation is a umbrella term that means things that are associated together, things that are connected together, intertwined together, become disassociated. And so there are a couple things that can be dissociated in this context here. We can have mind-body dissociation. We can have self and self dissociation. We can have experience and reality dissociation, called derealization, or in the context you just described, depersonalization, where the personhood or the humanness of this experience is disconnected, where a person doesn't feel like they're embodying their personal experience. We can also have dissociative identity. We can also have dissociative amnesia or memory. And the parts of the brain that deal with this sort of connection becomes, with a lot of people, disconnected or impacted, if you will. And so to your point, yes, if a person is dealing with dissociation, it is almost impossible for them to recover in the treatment. They will have to deal with those sort of reassociations before they can move forward. You can think of it like, I'm thinking of, I feel like there's a movie or so where, like, let's say different parts of your body are cut off and you're trying to move forward. You kind of got to go back and get this part of your body or go back and get this experience before you can kind of move forward. We can see that sometime, and why therapy can be helpful in this regard, where a person feels that they're disconnected in their own narrative. And sometimes they want to go back into certain paths and reclaim something about that particular narrative before they can move forward. And so dissociation is a important concept and experience in all of therapy that, if it's not addressed early on, then the treatment can be wrecked.
So to sort of tie this all up, let's sort of close out this loop, because I could keep you for another 2 hours, as our audience can tell, but you've been very, very kind with us. The expression of our nervous system is going to be different if it's a physical expression, right? If we're in our flesh, if we are in the and what we're going to be able to do to heal ourselves if we are in the survival mode. And if we're in survival mode, of course, we can't heal, because all we're looking to do is looking for threats and protecting against threats, as opposed to when we're in the parasympathetic expression of our nervous system, where we're now in a place where we can heal, and we can now allow our intuition to assist us with how we and our partner doctors can move forward with healing, as opposed to the spiritual expression of our nervous system, which is where we now can reach through the curtain and bring back healing from the spiritual realm. Give me your thoughts on those 3 different expressions of our nervous system, and why it's important to stay out of the sympathetic expression of our nervous system, because we will only get sicker and sicker and not be able to receive the information we need in order to be able to identify what is causing us to be sick, and ultimately identify what we'll need to do in order to be able to get better.
Yeah, so I think in some sense that to live out our fullness and to live out our kind of spiritual expression, that we have this spiritual expression that's happening through our bodies. And if our bodies and things are sick or impaired, chronically stressed, then the spiritual expression can't take place at its fullest. And so in that regard, if we are to reach a sense of spiritual enlightenment, we really need our bodies to be as healthy as possible to do so. The signals that we experience, the information that's been passed all around us, we don't pick up sufficient information, we don't process it very well if these aspects of our body is off or dysregulated. And sometimes people will say, I want to hear from God, and I can't hear from him. I want to know what I need to do next in my life. What direction should I take? What decision should I make here? And I can't hear that. Sometimes the reason one might struggle with that question or those series of questions is what we're talking about today. The chronic stress response, the dysregulation in our immune system, the dysregulation in our nervous system, the dysregulation in our guts can make us feel in some ways distant from our spiritual deity and higher power and hearing from God, being able to get communication and information and direction. And I think in that regard, it becomes critically important that our most important thing that we want to accomplish in life is in some ways preserving our body and taking care of that, because throughout the rest of our lives, we're going to be needing to have this sort of communication and conversation ongoing. That's going to be very hard to do if our body's not there with us. And it becomes a life unfulfilled if we're in this chronic state all the time, that we get to a place where we question not only our existence, but our achievements and our accomplishments. And we look back on things and sometimes we cannot be very satisfied. We can find in some ways that life is not as meaningful as we thought, that we were robbed of things. And I think in some way that to be able to have the experience that we feel is worthy of recognition, or worthy of applause, or worthy of approval from our spiritual connector, taking care of this becomes imperative toward that aim. And I think that being able to live a life of vitality and expression and meaning is incumbent upon us to adhere to how well we take care of our body in this process.
Dr. Winfrey, I can't thank you enough for sharing your beautiful mind with us. This was an unbelievably powerful podcast. I want to thank you for either, from my perspective, teaching me and Matt a great deal, or from Matt's perspective, you slapping me up during the course of this podcast. It really is real. This has been unbelievably valuable, and I thank you for sharing your brilliance with our listeners.
Thank you. Thank you so much for having me. You're welcome.